Good morning, everybody. If you would like to take your seats. I'm distracted by that cup. It's like a bit player in today's conference. Welcome, everybody, to day 2 of the WHO's second global conference on air pollution and health. Is there anybody who wasn't here yesterday? I'm fast forwarding to the end. Is there anybody who wasn't here yesterday? Please raise your hands. Okay. I'm just going to tell you that there are interpretation devices just outside. If you need to use one, number 1 is in French. Number 2 is in English. Number 3 is Portuguese. And number 4 is in Spanish. Today we have some high-level sessions. We're already high level, so I think we're going to go Mount Everest high level at some point today. If you are asked to come back into the theater very quickly, please do so and take your seats. So today's first session, our first plenary session, is really about what are we all doing here? It really brings together our reason for being here and gathering as a community, driving sustainable economic development, limiting climate change, and then also improving public health. That is why we're all here, plus also networking, getting to know who we can work with. We start with a keynote, and the keynote is going to be, I love keynotes that take you down the ground, give us problems and solutions all in the same time, and delivered beautifully in 5 minutes. I could not do that, but our keynote speaker is exceptional. I'm going to invite to the stage Sankaru Toure from Permian Health Lung Institute, the Gambia. Welcome. Thank you for starting us off. We appreciate you. Good morning.
Good morning, everyone. It is an honor to be here today to share my perspective. I'm a pulmonologist from the Gambia, and I practice clinical medicine. And I wonder, how did I find myself on this stage today to talk about air pollution? And I'm going to tell you a short story. When I finished my training in the United States, I went back home to Gambia, and I found out that I was the first person to specialize in pulmonary diseases and critical care. And I started seeing patients there, and I was expecting to see mostly smokers. And I did see those, but in addition to that, I saw a lot of young women who have never smoked a cigarette a day in their lives that had a lot of respiratory symptoms. And at the time, I had brought some of the fancy technology that I could get in the United States, so I was doing some lung function testing and also exhaled nitric oxide testing. And I found that they had, in addition to a lot of respiratory symptoms, COPD at a very young age that could not be explained by smoking cigarettes, and they did not have tuberculosis. And so I started asking myself the questions. I said, well, there must be something they're inhaling that's causing it, right? And so I wondered, what is air quality like in Gambia? And I found out that there was no publicly available air quality information in the country at the time. And so I got very frustrated. And I decided that I was going to try to address that issue. So I partnered with the National Environment Agency in the Gambia. I came back to Houston, and I bought a bunch of low-cost sensors, and we started installing sensors in the Gambia. We held, well, if you want to get something fixed, you get the brightest people you know, and you put them to task. So I got all the smartest people that I knew in Gambia, and we held our first International Day for Blue Skies and Clean Air in 2023. Since that event, we have installed a total of 26 low-cost sensors across the entire country, and we have the first reference-grade monitor, thanks in part to partnerships from the University of Chicago Energy Policy Institute. And with that network, it proved my clinical hypothesis that air quality in Gambia is poor. The average annual PM2.5 concentration in Gambia is 37 micrograms per cubic meter. That is 7 times the WHO standard. And not only is it that bad, there's significant seasonal variation. In the dry season, when there's the Hamatan dust storms, we see a lot of increase in the PM2.5 concentrations all the way to 44 micrograms per cubic meters. A lot of the women that I saw in Gambia were involved in fishing and also fish processing. They smoke fish. And I know we talk about the 7 million deaths that air pollution causes each year, but that does not capture the lived experiences of these women who have to deal with difficulty breathing, cough, lost productivity, and also the effect of air pollution on their children, who are also exposed to poor air quality. And so when we think about air pollution, it's not just about mortality, it's also about lost productivity. It also has an impact on our economic productivity. And at the WHO, we define health not just as the absence of disease, but also a state of general physical, mental, social, and I would argue economic well-being, because a lot of these women have a livelihood that's tied to these economic activities that are associated with exposures to toxic air pollutants. And so today I want to share our experience in Gambia as how one annoying clinical question at the bedside can inspire someone to mobilize the resources as healthcare professionals, to talk to our leaders, policymakers, to take action to begin to first measure air quality. What gets measured gets improved. And if you're going to implement any policy to address air pollution, you have to have a way of demonstrating that what you're doing is working. And so I want to use this opportunity to state that we need to really think about air pollution not only as a health issue, but also an economic issue, and that we need to partner in forums like this where we have experts, leaders, and policymakers that can actually help us come up with long-term strategic policies that can help navigate a transition to cleaner energy sources that will yield a dividend for our country's economic growth. I want to thank you for the privilege to be here from the small country of the Gambia. So we don't get a lot of attention, but I think that hopefully my clinical experience can illustrate how we can partner and also share experiences around the world and inspire others to take action from the bedside. Thank you very much.
We go from a doctor's story to a donor's story. Norway has long been a supporter of the WHO's campaign to get cleaner air and to work with climate change and climate action. And it's my pleasure to invite to the stage, although I'm sure he knows it very well, the Norwegian ambassador to Colombia, Niels Martin Gunning. Welcome, good morning.
Thank you. Well, first of all, I would like to thank the government of Colombia and the World Health Organization for organizing this conference and for the opportunity to speak to such a committed audience. Well, we just received a very powerful testimony from Dr. Touré. I would claim that we have enough evidence that air pollution has a detriment effect on human health. The costs to our societies are huge, amounting to 6% of the world's GDP. And what's more, there is no doubt that air pollution disproportionately affects the marginalized, including women, children, and the elderly. Air pollution kills. Almost 90% of all premature deaths due to ambient air pollution occur in low and middle income countries. Now, I represent a country which strongly believes in the implementation of the convention. Norway has, in fact, reduced the number of premature deaths attributed to air pollution by 55% in 2022 as compared to 2005, well ahead of the goal for 2030. We believe that universal health coverage, social services, and resilient health systems are key in mitigating, preventing, and responding to the effects of air pollution and climate change on health. And therefore, strengthening health systems is fundamental. Multilateral cooperation is more important than ever. Norway has supported WHO's work on environment and air pollution for over a decade, and we remain committed. We look forward to WHO's implementation of the roadmap on air pollution, and we welcome the roadmap's focus on vulnerable groups and equity. Understanding the interlinkages between climate, environment, air quality, and health is critical to find solutions to these huge challenges. In addition, close cooperation with cross-sectors and stakeholders across the UN, the World Bank, governments, civil society, and the private sector is essential. We're also convinced that local communities and healthcare workers have important roles to play in promoting the necessary transformations, as demonstrated here in this conference. But perhaps most important, more than 2 billion people lack access to clean cooking facilities worldwide. Nearly 4 out of 5 persons in Africa, around 1 billion people, still cook their meals over open fires or traditional stoves using polluting fuels. The summit on clean cooking in Africa that Norway co-chaired last year mobilized $2.2 billion worth of financing and investment. Norway, on our part, has committed to invest approximately $50 million to support clean cooking in sub-Saharan Africa. By working with strong partners, as the World Bank, the Green Climate Fund, UNEP and UNDP, on key areas such as forest protection, clean energy, and food security, we have a real potential in leveraging co-benefits for air quality, health, climate, and sustainable economic development. Dear colleagues, this conference has built a compelling case for the urgent need to step up efforts to improve air quality, mitigate climate change, and enhance adaptation. If our goal is to save lives and lay the foundation for a healthier and more sustainable future for all, I can think of no better investment. Thank you so much.
Thank you, Ambassador. Our conversations that we have on this stage do not stay on this stage. You are part of that conversation as well. As you listen to our panelists, our keynote speakers, if you've got a thought, you have a question, hold on to it for about the next 35 minutes or so, and I will bring you into that conversation so that we can all speak together as a community. Our first mini panel, I'm going to call our panelists onto the stage. Akash Srivastava is Director of the Ministry of Health in India. Welcome, good to have you. Gloria Balboa is the Under-Secretary of Health, Department of Health in the Philippines. Welcome. And Opiano Suarez is the Mayor of Mendoza City in Argentina. Good to have you. Welcome, Mayor. Excellent. I'm going to ask you, Akash, if you can pick any seat other than that seat. Thank you. Unless you would like to moderate. I will co-moderate with you. Appreciate you. And then she's at a press conference, so Maria, Dr. Maria, will be joining us later. When she tries to stealthily get on the stage, I would like you to give her a round of applause because she is multitasking like a boss. I want her just to slink onto the stage. Yes, she's being applauded before she's even here. And you know that she will just act like it's normal part of her day and jump straight into the conversation. So she will be joining us in a moment. All right. Good morning, panel. It's so nice to see you. On your seats, you will also have interpretation devices, should you need them. Akash, let me start with you. In terms of what India is doing right now regarding health, saving people's health, saving lives, what would you say, what would you point to that are successes that you would like to share with us?
Thank you. Good morning, WHO.
Oh, I have a microphone on the chair. Fantastic. And I believe it's on. And just say the last few things that you just said.
Yes.
One more time.
So, good morning, everyone, and thank you, World Health Organization, for organizing this wonderful conference on air pollution. First of all, I would like to say that we, in context of health, already have a strong presence of researchers and civil society of Indian origin who working on the Indian evidence of connection between air pollution and health. A lot of them have joined here in the conference as well. At the Ministry of Health and at the National Center of Disease Control in India, we in 2019 initiated a national program to address air pollution and health. And in fact, it is embedded under the National Program on Climate Change and Human Health to give a clear message that both are connected. We developed our National Action Plan on Air Pollution and Health, and the Honorable Union Minister of Health released it in the year 2021. And then last year, we had the state-level action plans on air pollution and health developed, which was released none other than the Prime Minister himself in October 2024. Every year before the beginning of the winter season, when air pollution gets bad, the Secretary Health writes an advisory to the Chief Secretaries of all state governments on the same. We have a lot of IEC campaigns that we run throughout the year, and specifically during the winters. In September, a week-long campaign happened during the UN International Day for Clean Air for Blue Skies, and in December, we run this similarly for a week when we have our National Pollution Control Day. We've developed training modules for our health workforce and run trainings for all entire cadre, specifically for the frontline workers who connect not only with the local, rural, and urban government bodies, but also with the vulnerable communities, specifically taking the message to the women and children for household air pollution. We have been working with the Medical Council and finally included air pollution into the medical curricula of medicine and allied disciplines. We have set up a national sentinel surveillance for air pollution and health, which is electronically captures the information on respiratory emergency, both adult and children, from sentinel hospitals. Today, more than 200 plus hospitals across 30 states of India report daily on these sentinel hospital surveillance systems. We today capture respiratory emergency, but plan to include cardiovascular and cerebrovascular incidents in the same surveillance systems. We've also disseminate early warnings on air quality forecast right up to the district level for our health workforce, and also they take it in cascade manner down below to the health institutions.
Akash, what would you say would blow the minds of our audience right now? Tell us the thing that they would go, oh my goodness, I'm so glad Akash is on the stage. What would that be?
So,
one thing in one sentence.
So in one sentence, I would say, first of all, the high-level commitments that we have, right with the Prime Minister making up this release of this air pollution and health-related action plans across 36 states and union territories were actually a very high-level commitment. It is followed up with the high-level committees also monitoring.
Great. I'm going to share the conversation. Thank you very much. Gloria, what are the opportunities for finding funding for the health sector when we're looking at basically improving the air in your region, in your country? What are the opportunities? Because we're always talking about the challenges, how hard it is. Let's talk about opportunities.
Okay, yeah. Muchas gracias and buenos días. Okay, well, I'm very happy to be here and to share the what we're doing in the Philippines, specifically on our financing mechanisms to support air pollution control and health interventions. Okay, well, our country has already made a great stride in integrating environmental health into the primary healthcare services under our universal healthcare framework. And since the burden of environmental health and the pollution problem has been increasing, what we're doing in the Philippines is to focus on prevention, early detection, and expanding treatment packages to pollution-related diseases. Okay, so it is a combination, the funding source is a combination of several sources, like our regular budget that comes from our General Appropriations Act. So there are budgets coming from or allocated to the Department of Health, which is integrated in our environmental health programs, and then disease prevention and also health promotion. And then, of course, we have funds from the Department of Environment and Natural Resources that is focused on enforcement of regulatory mechanisms. And then there is this Air Quality Management Fund under the Clean Air Act that source out funds from fees and fines that has been imposed and damages awarded to the government, and this is by the Pollution Adjudication Board for recovery and rehabilitation of the ecosystem. And then we have this latest program, convergence budgeting in risk resilience that optimizes resources by integrating climate change responsive projects into national and local planning, because this is very important. And then we have our health insurance. Okay, this provides or covers treatment in hospitals for pollution-related diseases, especially respiratory and heart diseases, and then, of course, it's expanded to primary healthcare services. And we have the popular sin tax revenues that we have in the Philippines, which is that has a significant amount that has been the one collected from tobacco and alcohol embarked on. Thank you very much. A significant amount of that revenue is earmarked not only for health insurance, but also for health promotion initiatives, like healthy communities, healthy settings, healthy workplaces, and others. Okay.
Gloria, that applause came at the right moment, because it was for you to thank you for your intervention, and also for Dr. Maria, because we were not going to let you sneak on the stage.
Yes.
So welcome, Dr. Maria, to the conversation.
Yeah, I'm sure
we
Maria
appreciate you. You are multitasking like a boss, and the audience feel that as well. Good morning, welcome. All right, and we're going to pause for there. Let me ask you, Gloria, what are you proudest of? Which of these initiatives, every time you see it in action, gives you the most joy?
Oh, well, because we have this National Environment and Health Action Plan that defines the different activities that need to be done to have this air control activities and health intervention. But of course, here, the different roles and responsibilities of the different agencies are defined there. So we have this multi-sectoral collaboration, and then the funding is also there, coming from these different agencies. And yeah, it's good to integrate it and to mainstream it in our climate change initiatives and other related air pollution activities. But, we need still to have sort of a dedicated funds specific for air pollution and health interventions, because, with the limited budget that we have, of course, we always struggle to have a bigger share of the budget.
And we are going to be talking later on, in a session later on today, about financing.
Yeah.
Where do we find the money? Where does the financing come from? Mayor Suarez, whenever I talk to mayors, they always will tell me the mayors do the work. The policy comes from wherever the policy comes from. But the people who have to do the hard work, change policy into practical change, are the mayors. So I love it when I have a mayor on the panel, because I know that they're the most hardworking out of anyone else on the panel, because they have to implement. All right, having said that, how do you tackle air pollution on a city level? How have you been doing that in Mendoza?
Bueno, muy buen día. Muchas gracias. Thank you so much for this invitation. It's important that a mayor of a city will be present in this conference because, as you were saying, we have high-level commitments such as the Paris Agreement. But the agenda against climate change and the agenda to reduce air pollution is given in the cities. The battle is in the cities. We live in a world, in my country, in Argentina, 90% of our population live around cities, and to 2050, planet 2 of 3 people are going to live in cities. So this is really important the moment we define a strategy or a plan. And I reiterate, apart from the commitment, high-level commitment, a political decision to move forward with a plan, but also a planning and a management of a databases with evidence. We cannot generate a strategy, a mitigation or climate change adaptation if we don't have evidence. What did we do in Mendoza? We updated our greenhouse gas emissions. We reduced it. We declared the climate emergency, which is associated to air pollution. And we fixed as goals to reduce gas emissions to 2030. We have seen as a plan in action can allow to obtain these outcomes, and this will habilitate us to establish more ambitious goals as we have faced a reduction of 51% of gas emissions polluting to 2030 as an unconditional goal, with the possibility to finance and reduce 66% of greenhouse and pollutant gas emissions. So planning, political willingness, management based on evidence, governance, to articulate a health sector with environment sector. Something that I wanted to say also is the importance of the anatomy of the cities, the relationships with the conditions, the health condition of people, and we are seeing this in South America. The planning growth of that density, urban density. Today, the cities are thought for the vehicle. And here we have one of the most important emission issues as the mobility. In case of my city, 48% of those gases, pollutant gases, come from mobility. We are moving with specific actions for mobility, waste management, and energy. And also, I insist of the importance to measure the problem. We are moving with a new air for childhood, establishing sensors, air quality sensors in different parts of the cities with a reach of 5 kilometers, where those spaces are interacting children 1 to 4 years old to determine what particles are found there and amongst other polluting gases. And this allows us to take decisions from the planning, management, and evidence. We are able to obtain those outcomes.
Outlined planning, political will, governance, those ingredients will work anywhere in the world in order to improve air quality, to actually help slow down climate change. Is that a formula that if you're in Nepal, if you're in India, if you're in London, that it will work anywhere?
Yes, we can see climate change, air pollution does not recognize boundaries. We see the situation from Norway, Gambia, India. In this, we need to value the government roles, the local governments, cities, and one of the difficulties that we have is the poverty and social inequality that we need to manage on a daily basis. When we talk about pollution levels, air pollution levels, 98% of cities of countries of a medium or low income countries don't comply minimum standards, normalities in air quality, and this percentage is much more better of high income countries. So at the time, we need to define a global agenda. We need to understand what are the needs and priorities in countries where poverty is like 50%. So from here, we see a lot of priorities, and we need to understand that the impact of air pollution has and impacts most vulnerable people of societies.
If you're listening to so many experts here at the second Global Conference on air pollution and health. What is the role that the WHO plays in helping countries, cities, regions achieve their aims regarding air pollution and also controlling climate change?
Thank you. Thank you for the question, and apology for my entrance. I thought, yeah, the applause, no, I realized immediately that they were not for me, so I am reassured. But,
Dr. Maria, it was for you.
Thank you very much. Somebody told me once that the role of a mayor is probably one of the most rewarding ones, because you have this opportunity of being holistic and multi-sectorial. Sometimes I think that working in WHO and having this institutional power of WHO and the convening power of WHO give us a similar situation. Of course, we cannot take decisions on promoting a sustainable transport system on a city or global in the world, but it gives us the opportunity to be a little bit in all the fronts. So we can help mayors, for instance, by providing you the health arguments. We can even help you to win your elections. Yes, I mean, if a mayor who needs to take certain decisions about a sustainable public system or the reduction of areas where the traffic is very intense, we can quantify for you what are the health benefits, and you can use that as an electoral campaign. So I think health can be the motivation, the argument, the consensus, the glue that will put all of these policies together. So going back to your questions, the benefit of WHO is exactly that. We can try to push in all directions, legislation, providing and monitoring the health, quantifying the health benefits, pushing on better data collection, negotiating on the different fora, and particularly on the climate change fora, COPs, for instance, making sure that everybody understands the overlap between the causes of climate change and the causes of air pollution. Working with the academic institutions for them to provide you all the scientific evidence you need and their voices. Because if a pediatrician works with a mayor of a city explaining why you are taking certain measures in the city, at the city level, I'm sure that that pediatrician or an internal medicine or whoever health professionals can help you to pass this message. I think that the holistic approach is the most important one, and somehow the way WHO can work and support the countries by putting together the scientific community, the legislation, the parliamentarians, the mayors, the governments, of course, and making sure that the benefit of that is the one that will generate a further motivation, quantifiable, and of course, giving this target that we are all trying to commit to will be an incredible objective. Nothing more rewarding than working for public health. And we are all working for public health.
This is day 2 panel of this conference. So we're coming towards the end. We have a whole day ahead of us, but we're coming towards the end. Akash, I'm just going to ask you in one sentence, what did you want to achieve by coming, and did you achieve it?
Well,
if you use the microphone. Great, thank you.
so this conference gave an immense opportunity, first of all, to interact and hear what the scientific communities and different countries have doing in context of air pollution and health. It's helped me to understand what could be the new initiatives that I could take up when I go back to my country.
All right, thank you. Gloria, what was your mission, and did you achieve the mission?
Okay, yes. Well, because for quite a time, for funding assistance, no, that's my topic here. For quite a time, most of the funding are going to environmental concerns. But we have to understand that, the issues on air pollution is not just an environmental issue, but more of a health problem. It's also a social issue that we have to invest more on health. because,
Your mission was to do...
Yes. So my mission here is to really, advocate to all those who are here that we have to increase funding for health interventions, because clean air, as we say, as we are discussing here, is really a fundamental public health issue. Okay. So it is a right. It is not it's not just. Thank you. It is a right, it's not a privilege.
Indeed.
So we have to make sure that we invest more in really coming out with health interventions to mitigate the health impact of air pollution. So we have to work together to really put health in the center of our advocacy for air pollution control. Thank you.
Thank you, Gloria. Mayor Suarez, in a sentence, what did you come here to do? And are you achieving it?
Se está logrando a partir de escucharlos.
Yes, it's been achieved. This is an honor to listen to those experiences from different entities. And this afternoon on the city's panel with other mayors, we'll be able to work as a network. We have big challenges of building cities, and cities that are planned, that are sustainable, that are centered, people-centered, and as mayors, with the territoriality that characterizes us, to be able to achieve that triple impact with our work. Economic development that is compatible with social inclusion and with the care of the environment or the protection of the environment. Our actions have to be focused or centered on people, and to approaching the protection of the air is critical.
Did that turn out on your phone? Did you take a photograph of the panel? Did you like it, or would you like us to do it again?
Of course, I like it. Every single person sitting there is fantastic.
The whole. You didn't want them to stand up and then for me to take one of you against them.
Amazing.
All right, let's do the amazing. All right.
Can I tell you something?
Yes, please, go ahead.
You were asking, what do I want to see after the day,
Sure.
the conference? Just one thing. I want each of you, everyone sitting here, leaving this room today or tomorrow, feeling like a pollution terminator. And we will be an incredible army of terminators.
All right. Okay, Terminators, please stand up. Maria, panel, stand at the edge of the stage. Just this way. Stand up. Thank you. Good to stretch our legs as well. We're halfway through this session. We're going to take it this way. All right, so you turn around. You turn around here. Do you know, I knew I would use my degree some way. All right. I'm going to take a picture this way. Maria, do you want to take it as a selfie? You got it? A selfie, or do you want me to take it for you? All right, very good. Excellent. Say clean air. Clean air. All right. Very good. And now I take one. Let me see if I can. Ooh, this is looking great. You really turned out today, conference delegates. All right, one that side, leaving no delegate behind. One this side, and the professional photographer is saying, Femi, get out of the way. All right, panel, thank you so much. Please take your seats. We appreciate you. We have no time for me to be in this photograph. Please take your seats. Thank you, Mayor. Thank you, Mayor. Please leave your interpretation devices on the seat. If you brought one on the stage with you, you may take it with you. Otherwise, we will move on. Thank you for stretching your legs and being in that photograph. Thank you, panel. We appreciate you. We move on with our program. These are the parts of the program that I really look forward to. And it's always the personal testimony so that we understand what we're doing here, why we're working so hard. I'm going to go to the founder of the Latin American Coalition for Clean Air, who will be joining us via video, Alejandro Dali. Hello, Alejandro.
Hello, everyone. First, I want to thank the World Health Organization for the invitation. It is an honor to be here with you today. I wish I could say that I see many familiar faces, but I'm not there standing with you. A travel ban against Venezuelans in the US prevents me from joining you in person. This is one of many moments in my life where forces beyond my control shape my future. These forces have marked my life, yet never defined it. My name is Alejandro, and I was born with asthma. I remember growing up with my inhaler and with my mom yelling, "Don't run, you're gonna have an asthma attack." I had many of those. At 16, I had to flee Venezuela's political crisis and start a new life in Colombia. After I arrived in Bogota, my asthma got worse. I didn't know why. I only knew that I couldn't breathe. That's when I learned about air pollution. Like my forced displacement, air pollution reminds me of how things that are out of your control can still dramatically shape your life, taking away agency from you. The air that we breathe is filled with invisible threats, pollutants that seep into our lungs, into our blood, and into our future. Just in Colombia, one person dies of diseases related to air pollution every 50 minutes. As co-founder of the Latin American Coalition for Clean Air, I have joined efforts with over 12 organizations in the region to lead campaigns mobilizing over 50,000 young people to take action. From teaching children across public schools in Colombia how to use low-cost sensors to monitor air pollution, to giving recommendations to the Inter-American Court of Human Rights. Our experience tells us again and again that in our region, clean air is a privilege. It is not a right. I remember in 2018, I stood in front of one of the most crowded public transport stations in Bogota, alongside a giant pair of cotton lungs I had built on the streets. For half a day, I stood there and watched as the cotton lungs became darker and darker with air pollution. Thousands of people on the streets also saw it. But I remember a police officer looked at me and said, "This is my station. Do you think my lungs are like that?" I did. The truth is that the climate crisis is a public health crisis. Those cotton lungs have been replicated hundreds of times in Colombia, becoming a symbol not only of the air that we breathe, but also of the air that we want to breathe. We must act. We need an energy transition that prioritizes life over fossil fuels, that prioritizes human rights, and that understands that health, climate, and clean air are intimately interconnected. This fight, however, needs more and new voices. More young people like me, especially from the global majority. More people living with non-communicable diseases. More of us demanding what should have been never taken away from us. The right to breathe clean air. And we should not stop. Correction, we will not stop until we win. Thank you.
The Vice Minister of Health from the Ministry of Health in Cuba, I'm hoping is in the room. And walking towards me, you've just made my morning, Vice Minister. Khalida Pena Garcia, welcome. Thank you for joining us.
Buenos días. Inicio mi intervención.
Good morning. I will begin my intervention thanking the organizing committee of this conference for the opportunity granted to us to address you on behalf of my country. During the 4 days of development of these meetings, all the speakers have mentioned the harmful effects caused on human health, the prolonged exposure to an atmosphere that is not. Because of that, I will stop mentioning the breathing diseases, cancers, other non-transmissible diseases, harm to the health of pregnant women, children, and adolescents are one of the problems that affects the population in Cuba. Some of them are the main causes of mortality and morbidity in the population, such as the case of cancer. Establishing a possible link on the cause of in certain strata of the population with the environmental affectations is one of the things that we should continue studying if we consider that each year in the world deaths, premature deaths associated to this phenomenon increases. Cuba has a national health system that is free, accessible, and universal, that allows providing medical attention at all levels, being the basis of the system, the primary care, where the promotion and prevention actions are done for the facing the harm to health. Counting in our country the policies that protect the realization of the actions, starting on the government's will, the social achievements, and the scientific capacity coordinated, have allowed the development of plans and programs for facing climate change and air pollution. All these measures go towards, as a country, to face the main causes related to this phenomenon. The declaration of the soil, the contamination generated by obsolete technology in industries, the improper treatment of waste, the effects of mining and transportation, mainly for those who that we have preventive measures managing the environmental effects on the economic increase. Same way, it is necessary to extend and keep the progress achieved on health and education, components that are essential for the well-being and the human development. With that in mind, the country proposed a state plan to face the climate change. The Task for Life, approved in April 2017, inspired on the thought of the historical leader of the Cuban Revolution, Fidel Castro Ruz. It is made up of 5 strategic actions and 11 tasks, with the multi-sectoral participation and with legal protection, starting on the recent approval of the Law 150 of the Natural Resources and Environmental. It is necessary to refer to the support given by international bodies on the development of projects, plans, and programs to face the climate change and air pollution effects. We are going to mention some. The Renewable and Efficient Sources Protection Project, which seeks to improve the use, increase the use of sustainable energy sources to prevent the greenhouse effect, and it pretends to approve 24% of the electrical generation in the country on renewable sources by 2030 and 100% of them by 2050. It foresees the construction of the photovoltaic parks, the installation of electrical pumping systems in the hydraulic system, substituting the public lighting with LED technology to reduce air pollution. It pretends the development of new technologies to clean and reduce emissions in sugar cane plants. These have been effective in reducing solid particles with Cuban standards. Other actions take place in Cuba. For instance, improving vehicle verification program, control contaminant vehicles, the reduction of volatile organic compounds in domestic and cosmetic products, and it has been evaluated in this conference. We are a country that applies the methodology RQ Plus for the environmental protection. Colleagues, humankind still faces challenges that we have to be prepared for. The effort to reach levels of reference on the contamination of the air, the countries, in that effort, the countries will be protecting the health of man and mitigating world climate change. Let's activate today. Tomorrow it could be late. Thank you very much.
Thank you. I'm going to call on to the stage our panelists for our second panel session before we break. Dr. Sumi Menta is the VP for Environmental and Climate Health at Vital Strategies. Hari Prasad Manali is Secretary of the Ministry of Health and Population in Nepal. Please come onto the stage and take a seat. Javi Lopez, Vice President of the European Parliament. And Javier Padilla is Secretary of State for Health for Spain. Thank you so much, panelists. We appreciate you. Take a seat on the stage. Welcome, everybody. Very good.
So, Dr. Sumi, you're a troublemaker because what you want to draw attention to is what has been missing in our conversation so far. Everyone is leaning in and wondering what is the missing element that we haven't been talking about.
Sure. Well, I think that what you're referring to is how we go from all of this exciting momentum and commitment to really working closely with governments to get to scale. And you know, this is something that we've really seen amazing work, amazing, exciting activities underway, particularly as we're thinking about how to get air quality and focus on clean air action into public health practice. And what we've really seen here, and especially with all of the experiences you've heard from India, the Philippines, from Thailand, China, and elsewhere, is in order to really advance now, we need to work very closely with the government systems to be able to make sure that these efforts can have the greatest impact possible.
Mm-hmm. Are you seeing a way to engage health workers? Because without health workers, we can't actually do implementation, right?
And just to be clear, this includes everyone from the civil servants to the policymakers to the frontline workers, and we're really thinking about how to work together to get better data collection, integration, and then use for activities.
Have you met with people, have you met with organizations who you feel they are ready to scale up? Or are we literally talking about governments here?
Well, it's really working with governments in partnership with others to be able to do this. You've heard so much about the exciting work to develop the WHO guidelines and practices for health workers, for example. We've seen from what Dr. Akash mentioned in India, it's not just about training a few hundred workers here and there. If you really want to scale, for example, what we've done, he talked about the training for frontline workers, for ASHAs. If you look across the country, India's a huge country. If you're thinking about even the work that we've done, for example, in 5 states of India, that would mean getting to scale not just 100 people, 200 people, really looking at a cascade model to train 250,000 ASHA workers to reach over 60 million households. This is really what I'm talking about.
Mm-hmm. Secretary Manali, if we're looking at Nepal, two issues in terms of air quality. One is domestic, in domestic households, and then one is ambient. How are you dealing with those double challenges?
Thank you. As we know, air pollution is a cross-cutting issue with several sectoral sources, but an ultimate impact on health. The Department of Environment, under the leadership of the Ministry of Forest and Environment, Nepal, is the leading agency for the overall coordination at the national. Based on the findings of 27 air quality monitoring indicators across the country, we are developing a national action plan and revising air quality standards also. Sectoral efforts including vehicle emission checks, electric vehicle adoption, and clean cooking solutions. We are actively involving the community in forest conservation through the Community Forest Program. The health sector has also proposed on air pollution reduction target in NDC 3.0. Nepal Health Sector Strategic Plan 2023 to 30 has spelled out clear strategic interventions to address the health impacts on the air pollution and climate change. In-service training has been provided to health workers to capacitate on it. Health workers have been engaged to sensitize the community people about the health impact of air pollution.
Mm-hmm. Thank you, Secretary Manali. If you had to pick one initiative that you're proudest of, what would you pick? Yeah. Just one.
Yeah. The most I'm
The one you would humble brag about.
Remarkable initiatives is the Constitution of the country, which guaranteed the fundamental rights of the peoples. So all these fundamental rights, including air pollution and reduce the air pollution and the healthy environment, is also included there. That is also political document also, political commitment also. So I think the Constitution of Nepal is the one remarkable and fundamental document of the country.
Okay, all right. Let me move on to Secretary Padillo. The health sector, you have to bring the health sector along with, okay, we want to improve air quality, we want cleaner, healthier air. How are you doing that in Spain? What are the incentives?
Muchas gracias.
Thank you very much. I believe that the first thing is to be conscious that health is the gate through which we can make real other policies that wouldn't be feasible were not through the use of the health argument. Industrial mobility, transport, I think it's fundamental from the health sector in Spain. I would point to three: raise awareness, connect, and act. On awareness raising, we have to communicate the risk without being catastrophic and looking to have a communication based on the best evidence available, and also doing it by trying to generate a health sector that is an activist in terms of watching over a healthier society, an environment, and an air with a better quality. In terms of connecting, it is about basing the health policies and the health centers as the centers of reference to watch over health, but doing it through the work of other ministries, ecology, transport, environment, and doing it through assessments, evaluations. It is not only enough to evaluate the environmental impact, but also the impact on health. And the third element is to act on specific things. In Spain, we are developing, for instance, systems, surveillance, epidemiological surveillance systems on environmental health, which is something that we didn't have before. We are adapting the recommendations for air quality to the specific risk of pathology that each country has, and we are moving towards a health system within this idea that health and pollution and climate change are linked to a health system that is neutral in carbon emissions by 2050. All that together will take us, or must take us, to the idea that from the health sector we have the fundamental task of communicating, but positively. We have been communicating for years the risks for climate change and pollution on health, but basing ourselves on the development of the diseases. But people does not change just because we put the fear in them. We need to be able to project a future that is more desirable, that is more aspirational, and to which one would want to go. And so from the health sector we need to carry that flag. Health, together with the economy and the environment, can project us to the future, to a future that is better. Quiero darles un aviso de 5 minutos. Si han estado escuchándonos a los panelistas durante los últimos 40 minutos y tienen una pregunta, aun cuando no estén ya en el escenario, les puedo pedir que regresen para responder sus preguntas. Tenemos micrófonos. Por favor, identifíquense los que tienen los micrófonos, uno acá, otro allá, perfecto. Así que mantengan sus preguntas ahí.
Green New Deal is no longer a new deal. It's been around for a while. So you can actually help us understand, well, what are the legislative challenges? How do you implement something as bold as a Green New Deal? What's your experience been so far?
Well, thank you very much. Our experience in Europe is the European Green Deal. That it was one of the flagships of the European Union during the last 5 years. And obviously we are facing one of the massive transformation, probably the most important journey of the humanity that we are facing. It not only makes sense, it's stimulating because it's tough and it's difficult, but it's like the life. All the difficult things, all the important things are difficult. And this is the most stimulating journey. What we are trying to do, first, decarbonize. And decarbonize, it means obviously change your mobility, ships, cars, planes, change your industry, change your buildings, and change your forms of energy. Probably it's the most important transformation since the Industrial Revolution. Secondly, protect the biodiversity. And third, fight against pollution, that it's one of the, well, not one, it's the main environmental threat for the human health. And we had in the European Union, under the European Green Deal, the Zero Pollution Action Plan and a new directive, a new law to fight pollution, that it was the Air Quality Directive, approved finally the last year, that we are really proud because it was a process of negotiation during 3 years with 27 member states, with the European Commission, with a lot of civil society that they saw involved during this process. But after this, we have a law based on the work done by the World Health Organization that we will cut the standards for pollution to the half in 2030. Why? Because this is for protect the human health, to protect the right to have clean air. But not only that, because we are protecting our public budgets on this. Third, because we are protecting our ecosystems. And fourth, and this is also really important, because we are fighting against inequalities. We are not breathing all the same air. This is important to underline, because it's counterintuitive. Like, all the countries not are breathing the same air, but like in the countries, in the same city, like all the people is not breathing the same air. And when we are protecting clean air, we are fighting against inequalities, we are fighting against climate change, and we are protecting the health of our citizens.
Javi, as you were speaking, your co-panelist, Secretary Padilla, was making notes. And I feel we need to know what is in his notebook. Secretary, I hope you're not making a note for your shopping that you'll be doing later. I know that you're always focused on the conversation that we're having. Okay, what's in your notebook?
Sí, la verdad es que estaba justamente anotando.
Yes, truth be told, I was jotting a reflection that I believe important on the directive of air quality, which is that I believe that every time that legislative packages are approved or passed in this sense, we usually put more emphasis on decisions than on the positive things that have taken us there. I believe that we can all say that we would want a more ambitious air quality directive, but I believe that we must also say that the European Air Quality Directive is a reference for most anywhere. And I think it's important to say this here, because over here in this forum there are represented many of the actors that make this move forward. For instance, the World Health Organization, I believe, generates a sort of pull incentives, hoping to pull government towards those places, those general benchmarks to which we should move. And I believe that the movements of civil society do the push of incentives, moving the organizations and governments to be able to progress in that sense. And I believe that that is something that must be put on the table. It may be that we might not move as fast as we might want, but I believe that it is clear that we want to move forward, and there is the willingness to move forward.
Sumi, your thoughts?
Yes, I was just reflecting on what you were mentioning about inequalities, and just wanted to emphasize that, it's interesting in this conference, we talk about air pollution at a global scale, then we have to think about how it's affecting places differently, and I think people are exposed differently, and people are also impacted differently. So I just was reflecting on the fact that for different places and different countries, we really have to focus in on prioritizing those solutions that are going to really reduce the inequities that we see in exposure and impacts. And just as an example that I wanted to emphasize, this whole issue of the prioritizing of the shift to non-renewable fuels makes a huge amount of sense as a global priority. But as we do this, we also have to think about what are going to be the scalable solutions for clean household energy, which continues to be a problem in so many places within South Asia and Sub-Saharan Africa in particular.
Panel, let's open up our conversation to our delegates. So if you stand up, the microphone will fly into your hands magically. Very good. Where are the other questions? On this side of the room, can we get somebody standing by? Fantastic. All right, we have the first and the second question. Good morning, sir. Go ahead. Keep talking and the microphone will come on. All right.
Good morning.
Good morning.
I'm Simon Burkett of Clean Air in London. Javi Lopez is extremely modest. He was the rapporteur for the new Ambient Air Quality Directive for the EU, which was supported by 26 countries with one abstaining at the European Council, and huge support in the European Parliament. It's an extremely good directive. I just wonder what lessons he has learned which might help other regions of the world, recognizing that they're all different, to introduce such powerful, valuable legislation to protect health and improve air quality. Thank you very much.
Lessons learned.
Well, thank you. The most important point in all the process was put the health of ours in the middle of the discussion. Because to be honest, like for politicians, it's quite difficult to be against the health of the city. You have other arguments, I agree. But it was the key argument, first. Secondly, during all the process, like the science and the work done by the World Health Organization, the guidelines made by the World Health Organization were extremely useful, evidence-based policies. And this is something that it's challenge now, and we have to protect it. And third, I will say the role of the civil society, the role of the professionals of the health system, the role of the NGOs were key during all the process to convince policymakers, to convince member states, and to push the European Union in the right direction. But I think we are moving in this direction, and this kind of events, it's obviously incredible add value in this movement.
Very good. Next question, please. Thank you.
Good morning. My name is Kelsey Armstrong-Valenchuk from the World Heart Federation. I have a question particularly for Dr. Sunkaru, if he's still here, but I'd love to hear from all the panelists.
Dr. Sunkaru is here, and he's standing at the lectern, leaping to it right now.
Wonderful.
The microphone is even live, waiting for you. All right, very good.
Thank you. I was so inspired by your story from the Gambia. Thank you for sharing. And I've been equally inspired by stories from other physicians throughout the conference, particularly pediatricians, pulmonologists, surgeons, even general practitioners. But to my regret, I have not yet heard from a cardiologist. And as the research is increasingly showing, air pollution impacts every organ of the body, but perhaps none more so than the heart. So my question is, with your inspiring story of really advocacy and action, do you see a future where cardiologists and other specialists are also becoming physician activists? Or do you think we're stuck addressing the traditional risk factors forever? Thank you.
Thank you very much for that question. So I think there's going to have to be a fundamental shift in how we educate healthcare professionals, because the training and the practice has not kept pace with the science. And I think that some of the work that we're doing, in fact, next month, we're having a training session for medical students in Gambia. Your social history is no longer smoking, diet, and exercise. It also includes being thorough about assessing your occupational and air pollution risk assessments. And I think the WHO's recent training program is a good starting point. They have a training kit for healthcare professionals that needs to be disseminated. But I think as healthcare professionals, we're also educators, and I think we have a role to play in disseminating that information in the profession.
So do you see a future where cardiologists are also?
Absolutely. I mean,
yes.
Heart disease, I mean, in Gambia, stroke and cardiovascular disease are the number 1 and 2 causes of death among adults. So absolutely, yes.
How far is this future? Is it 5 years, 10 years? Now.
Now.
Oh, I love that kind
Yes.
of future. Thank you. Please take a seat. All right. Who has the microphone right now? Hello.
Hola, buenos días. Soy Vanessa López.
Good morning. I'm President of the Health and Environment Alliance, Director of the Spanish NGO. And for me, it is an honor to have chaired this presentation that Spain is one of the sponsors of this company. I wanted to ask the panel, you talked about the Air Quality Directive as a point of reference, which is very important, and it is so. but now we need to move to the phase of doing everything possible in the countries at the various levels of administration. And I believe that there are important challenges in this regard, and I would like your opinion. One is how politicized environmental policies have become or are, and in a way, how can we, when working on the implementation of that directive with different authorities and political ideologies, what to do, how to do it, to put this topic as one related to health and nothing else, and then how to work with regional governments, local governments. Well, I would like your opinion, especially Javi and Dr. Padilla. Thank you. Thank you.
Javi, I'll give you the bit about how political it's become, and then Javier Padilla, I'll give you about the regional cooperation.
Contestar en castellano, ya que es una.
I will respond in Spanish. Well, first, what is it I believe is happening? What's happening is that in the middle of this huge transformation with a green agenda, this enormous positive transformation with the big changes, the same thing happens at the beginning. When the transition occurs is the moment when you see the cost, but still not the benefits. And it is the most complex moment, politically speaking, and we are at that moment. And some, I would say, that they want to use it as an instrument. What we need to do is to persist, and highlight and stress that the great transformation happens if public opinion is behind it. And we have good signals. I want to remind you that last week a referendum was held in Paris. Paris is trying to implement a policy and fight against the matter. I mean, they want to push cars out of streets and make them into pedestrian streets. 2/3 in favor to make 500 more streets at pedestrian only. We are talking about combating pollution, but also about making cities more livable and sustainable. And that is what we are doing. And on that, the governments play a fundamental role. Regional governments and municipal governments play a fundamental role. They are very much present here in this conference with this agenda of putting the citizen in the center, make streets pedestrians only, make cities more livable, and where you would have areas with several uses, electrifying vehicles, that great transformation of sustainability, but which places life and the citizen at the center of it, is the one that we need to continue to push. And especially remember that this happens if public opinion is behind pushing it. That is what makes it possible for institutions to move forward. Yes, thank you very much. I believe that in the current moment, the first thing is not to take a step back. I believe that we are at a time when there are many voices and symptoms and pressures for everything that deals with policies in the realm of the environment to be passed to the next decade, or be shifted to the next decade. And I believe that the time in that regard is now. And also, in reality, the response lies in the question itself. I believe that to save those elements of politicization, but not politicization so much as polarization, the response lies in the regional setting. I believe that we are all aware that political positions or stances that are adopted when someone needs to render accounts to their citizens citywide, municipal-wide, are very different than when you are talking big at higher institutions. So I believe that Eduardo Galeano said that the only thing that you build from above are wells. I think that in this regard, construction must start from the bottom, and it is the cities that precisely mark what the path is to improve the quality of air.
Now for this session, it's going to be... Who has the microphone? Please stand up. Thank you.
Buenos días.
Good morning. I represent a movement that is present in 170 countries of volunteers fighting for climate change. We are convinced that the technology is also a fundamental tool for the decontamination of air, of oceans, for instance, nanoplastics. We deeply thank the World Health Organization for allowing us to be here, but I would like to listen solutions. For instance, what do we know about the technology of water atmospheric generators, which help us decontaminate oceans and air. Do you see it as an alternative of a clean energy? Thank you for being here and for showing us the path.
Does anyone feel that they are able to answer that question briefly? Because I feel that that's a question that Dr. Maria would nail. Dr. Maria. Is excited to answer your question at the lectern. And this will be the last time I work here. I think it's more a generic question though, because are there solutions in this conference? You see me
watching you.
I humbly ask, how do we address the broad nature of what we're trying to do and bring solutions at the same time, Dr. Maria?
Thank you. Thank you very much for the question, and thank you for bringing this issue of technology and innovation that is fundamental. Of course, this is not the time to maybe go into specific technologies and others, but it's a piece of the puzzle. Definitely technology and innovation will help and contribute to that. But essentially, what we are trying to achieve here is to tackle the causes of air pollution, to mitigate, to reduce. And when you reduce those causes of mitigation of climate change and air pollution, this is the best way you will be protecting the health of your people. You might, in this road, use technology, definitely, but it's more going to the source of this pollution where we need to attack. Is that okay? Satisfied?
Is that okay? Yes? Yes? Thank you. Thank you very much, Dr. Maria. I appreciate you. Please take your seat again. Panel. Oh, yes. This is a 30-second response, Dr. Sumi. Go ahead.
I won't even take 30 seconds. I would just say that for almost every leading source of pollution that we have around the world, we do have solutions that are available. The challenge is to work together to figure out how to effectively implement them, and as I mentioned earlier, at scale.
Absolutely. Panel, thank you so much. Delegates, thank you so much. Panelists, please take your seats. Appreciate you. If you can leave your interpretation devices behind, take your notebooks, your notes, your pens, and then just gradually, carefully exit off the stage. If you were here on Monday for the pre-conference, you may have caught the Emerging Leaders for Clear Air Forum. There are 3 people who are about to come on stage who are the young leaders of the future. Let me just call Sheila Estrada Mesa. Sheila, please come and take a seat. Santiago Garcia Maza, please take a seat. And Melvin Otieno, welcome to all 3 of you. Please take a seat. We are going to be talking about, you're going to be sharing with us the outcome of that forum that was on Monday, the Emerging Leaders for Clear Air Forum. Welcome to the stage. Nice to see you. Seat here, seat here, seat here. All right. Everyone's got a microphone? Very good. Excellent. If you need a translation device, there's one on the seat. Okay. Let's start closest to me. And what are you sharing? The statement that you're sharing. Please go ahead. Okay. We're starting that end. All right. Thank you. See, leadership already. I appreciate that. Starting this end, and then the middle, and then here. Okay, perfect. I will keep quiet. Young leaders, take over.
Okay. Una llamada a la atención unificada por el aire limpio. Nosotros, los participantes del Foro de Líderes Emergentes por un Aire Limpio, un colectivo de investigadores en etapa inicial, jóvenes defensores, profesionales de la salud, activistas climáticos y educadores de todas las regiones.
Educators around the region, we are joining together with a common purpose, approach and address air pollution as a public health emergency and an obstacle for sustainable development. I'm Sheila Vanessa Estrada Mesa. I was born here in Cartagena, and I was diagnosed with asthma when I was 7 years old. Also, I was born with asthma. The same as millions of children around the world, we can take measures to silence all the impacts of air pollution in our lungs, hearts, brain, as well as other organs in our body. The air pollution does not need to cover headlines. So for us to act, we cannot wait for crises, disasters, or increased death tolls. We need to have a preventive action. It's not an option, it's urgent. It is essential not only to reduce diseases, but also to advocate dignity, justice, and fundamental right for clean air. This is not only an environmental issue, this is political, social, and economic. The unproportionate control of newborns, elder people, disabilities, and vulnerable populations is alarming. Scientific evidence has been clear for decades. What is missing is not knowledge, but implementation. We have policies, we have guidelines, but the action is usually delayed and lacking of resources or be obstaclized by political obstacles. Clean air is a human right, and rights must not be negotiable. In this crucial decade of our existence, facing 2030, we, youth, leaders, together with my colleagues in this second global conference for air pollution and health, representing all the regions around the world, we make a call for all decision makers, so civil society organizations, UN, and stakeholders with the following declaration. Commit to accessible transport and low emission transport. Eliminate all polluting vehicles to protect health and guarantee a sustainable mobility for all. Regulate and comply national policies, robust policies of air quality aligned with WHO goals, mechanisms of accountability, clear accountability systems, empower and educate citizens and future leaders in engaging air quality issues around all levels and professional levels to foster and drive a long-term policy, accelerate equitable access to clean fuels to cook, improving air quality indoors, and at the same time increase awareness, public awareness to eliminate air pollution in households, especially in vulnerable communities. Normalize open monitoring of air quality, inventories, developments of national emissions, funding of local research, and governance for guaranteeing a sustainable action based on evidence.
Environment, transport, urban planning, communications, education, energy, agriculture, and industry through interministerial coordination and foster inclusive dialogue with civil society to drive unified policy. Invest in clean air solutions where they are most needed by reforming global funding models and recognizing prevention as a cost-effective and life-saving priority. Redesign cities with expanded green spaces, pedestrian-friendly infrastructure, and integrated waste management system, using smart technologies and community planning to reduce policy and support healthy, resilient communities. We, the emerging leaders for clean air, commit to leading with integrity, science, and solidarity. But leadership cannot rest on our shoulders alone. We urge governments, industries, institutions, international actors to act not in the next decade, but today. Delays cost millions of lives. The science is clear. The solutions are known. The time for action is now. Clean air is not a privilege. It is a fundamental human right. And this right must be protected for all. Thank you so much. Gracias.
Thank you very much. Thank you. Please take your seats. We appreciate you. Our future leaders in health and climate. I'm going to leave you with something that is very striking, beautiful, but also sad and tragic. All of those three things together. Ella Roberta was a young woman who was the first recorded person to have died from air pollution when she had a deadly asthma attack. You will meet her mother, Rosamond Addo Kisu Deborah, in the next session. But for now, I want you to watch and lean into a poem about Ella. It's performed by Jada David. And take a look at the screen.
There's something in the air. No, it isn't love, even though it is tainted. There's something in the air. It's a lack of care from the government about its poorest civilians, allowing businesses to burn plastic, resulting in tons of CO2, up in the millions. Politicians choosing capitalism over lives, using their age-old methods of nepotism to decide whether it's the poor or the rich who have to live with incinerators outside of their homes and their schools, breaking their own rules. The UK signed the Paris Agreement, thus agreeing to reduce the carbon emissions in this country. Yet despite this fact, they're allowing incineration to continue, tax-free. I'm not exaggerating when I say air pollution kills. Air pollution steals the funds of our NHS. £1 billion was spent in a year treating asthma, while the profits of burning trash go tax exempt. Air pollution kills. Air pollution fills the lungs of our youth, and if you're waiting for the government to tell you the truth, then don't hold your breath. They won't tell you that 80% of rubbish sent to incinerators can actually be recycled. They won't tell you that air pollution was responsible for a little girl's death. We won't forget you, dearest Ella. Your life is one that everyone should know. 9 years old and 28 hospital visits. Asthmatic seizures forced your body to its limits, a couple of metres from one of London's most polluted roads. How many kids will get asphyxiated in your postcode? Hopefully we can save some lives if we all come together and say that we won't stand for this anymore. We are taking our air back. It's not yours to pollute and dilute with tons of carbon dioxide. How many more people must we see die from profit making and money saving? It should be the businesses paying for the pollution they're creating, not the working class paying with their lives. If they get away with facing no repercussions, there'll be no end to our suffering. We say enough is enough. And it's simple, really. Burn less, recycle more. We say to His Majesty's government, weave this into your laws, make incinerators pay for the pollution they cause. There's something in the air, and we do not want to breathe it in anymore.
This session has now concluded. Please take a moment to have your break. When you're asked to return, you will have a different moderator and you will be in a VVVIP high-level session. Thank you for your attention this morning. Enjoy the break. Thank you.